Hello, everyone, and welcome back to Let's Eat. Today, I thought, is the perfect day to talk about functional lab testing. So, for those of you who do not know, I am at the tail end of my certification to begin offering functional lab testing, which we will get into what that means, what that looks like, and why it might be something you might be interested in. I wanted to take the time to really open-endedly and in-depth get into the value of lab testing, why I wanted to pursue this as part of what I can offer clients, how it's helped me, how it differs from what we see in our healthcare system, and answer some of the questions that I got from my followers on Instagram about what this will look like. I also have an inquiry form that will be linked in the show notes. This is not a commitment by any means. You're not locked into anything. It's simply a space for you to fill out some information about why you're interested, because I obviously want to know what the need is, but then to also get on the list to be first to get further information regarding when it's available, pricing, what I'm offering, what it entails, what the process will look like, and so forth. So that is linked in the show notes for you to go ahead and review and complete. But I think that this will be the first of many conversations around the value, the power of functional lab testing, not only because this is going to be a big part of my work now, but also because there is so much that can be uncovered and identified through testing, through this particular type of testing. And as mentioned, it's not something that you're necessarily going to find with your primary care doctor. And so with that said, it's important that you know that it is in fact available if you feel like you want deeper answers. A lot of people turn to functional lab testing because they don't get the support that they need from their primary care doctors. And so that's also a way for you to maybe bypass the disappointment that sometimes can come when you're not given answers, you're not given solutions, you're handed a medication and sent off on your way. And obviously there's a time and place for our healthcare system and so forth. But I think people are struggling and suffering and living with symptoms, and there can be a lot that can be mitigated and identified through some of these tests. So that's why I'm excited about it, and I think you will be too. And we're going to dive into all things functional lab testing in this episode. Welcome to Let's Eat. I'm your host, Emily, certified holistic health coach, functional nutrition expert, and self-proclaimed wellness enthusiast, here to meet you at the intersection of physical and mental health, the space within which we become well. This podcast is meant to explore all areas of mind and body wellness, designed to offer you the integrative knowledge, behavioral strategies, and mindset shifts necessary to uplevel your health and feel better today. We'll explore nutrition, sleep, movement, self-care and stress management, habits and routines, self-development, gut health, mental health, and more. I am so happy that you're here. Welcome to the table. Let's eat. So before we dive in, I thought I'd set the stage a little bit. I am super comfy right now. I'm in my former therapist chair. This is a chair that I bought probably 3 years ago, maybe a little longer. And it was my therapist chair because I worked from home for the most part, seeing clients virtually, and I'd be sitting in the same spot for 6, 7, 8, 9 hours. So I wanted to be sure the chair that I was sitting in was ultra comfy. I could sit cross-legged in it. Okay, this was a big deal breaker. I had to find a chair that I could sit cross-legged in comfortably because that's how I'm sitting currently, but also that was just how I knew I would want to sit when I was seeing clients, because after a while you just want to kind of get comfy. And so here we are. And it's a deep chair, so it sits back. I could put pillows in it. So I'm currently sitting here in the living room, which is different. I usually don't record in the living room, but I was parked here already, and I said, all right, this is where it's got to happen. It's got to happen here. And I'm listening back to the audio, and the audio sounds okay. Before I was worried the audio wasn't so good because of my high ceilings, but I think that was just because I wasn't recording the audio properly. Honestly, looking back, I tried to record in here at the beginning of the podcast, so before I figured out the audio, and I was like, oh no, like the audio's not good. The ceilings are too high. It's ruining, and maybe it isn't as crisp as it is in the office because my office, my ceilings are lower, but I think I just didn't know how to use my mic properly, and so I've figured that out. Only, had to go through a full year of podcasting in order. No, I think I figured it out 6 months into the podcast, so I'll give myself some credit. And then next to me, I have a decaf coffee. It's like an espresso coffee. And I did almond milk and coconut milk and a scoop of protein. I have some lemon water. I have my bone broth hot chocolate. I have some yogurt. So I have a lot of things going on here. And we are getting into it. We're getting into functional lab testing. I completed the curriculum portion, which is 90% of the work. And then the last 10% is testing, and it's very vigorous testing. It's a lot of case studies and oral exam and written exam, and there's all those steps, and it's a little intimidating. I think it's maybe not as cumbersome as it appears, but it feels very overwhelming, like step by step what I need to do, and I have my test results that I need to go over with a mentor, so I'm waiting on those. I have one more test to send out tomorrow or Tuesday, and by the way, it's Sunday. I'm saying these days as if you know what day it is, but so there's still some work on my end, but as far as curriculum goes, that's all done, but I have so much to review. I have so much I need to go back and really review and read and listen to and go back to module 1, because module 1 I started in December. So how am I going to remember what happened in module 1, right? So there's a lot to do in the next few weeks. So I'm excited to kind of buckle down a little bit and really just focus on taking things one step at a time, and then hopefully planning to dive in by the second or third week in May. So that is the plan. But let's get into functional lab testing. Let's talk about it. Let me tell you a little bit more about what I mean when I say this, and what tests I've done thus far and what I've learned, and then how this could potentially help you. So functional lab testing is exactly what it sounds like. It's testing the function. We are testing health in a different way than maybe conventional testing does. And I feel as though it's looking at health on a more subclinical level. So what I mean by that is when I say subclinical, it's essentially looking at health and looking at dysfunction at a level that's not identified typically in a clinical setting. So I've referred to subclinical symptoms before, and when I say subclinical symptoms, I'm referring to the symptoms that we've kind of normalized but aren't meeting necessarily a criteria that would constitute a diagnosis. So when we say subclinical symptoms, we're referring to low energy or difficulty concentrating or indigestion or acid reflux or mild insomnia or irritability or anxiety of any kind. It's not to say that those symptoms can't still be diagnosable, but they're also not as significant in the sense of they're not going to be something that we necessarily diagnose. It might just be use this over-the-counter medication, or here, it's less extreme than, say, a collection of symptoms that would then constitute a diagnosis, like headaches from time to time. Is that something that we're probably going to maybe go to a doctor for? Maybe not. That might be just something we say, all right, every time I have a headache, I'm just going to have an Advil. Like, this is just what happens. I just have headaches periodically. And so I'm going to just take an Advil. Now, if we had a persistent headache that lasted over a week, then that would be something that we'd go see the doctor for. I pulled up a more concrete diagnosis, so it wasn't just me trying to explain this. Subclinical means the condition exists below the threshold that would typically produce visible or clinical signs, making it difficult to detect without specific tests or screenings. So it's essentially just something that's not always detectable, or it's not something that meets the criteria yet to actually offer a diagnosis. It's ideally identifying the imbalances or dysfunctions before they develop into a diagnosis. Now, I will make myself very clear now and throughout this episode, my job is not to diagnose. I am not diagnosing. Even if somebody comes to me with a diagnosis, a medical diagnosis, that is something that we can obviously consider in relation to uncovering the dysfunction that is probably there. But the point is not to use that diagnosis to then address the symptoms per se. We want to go much deeper than that and look at the chaos, the dysfunction, the imbalances, and so forth that might be taking place under the surface that can be contributing to what we now see as this diagnosis on the surface. But that diagnosis can sometimes pigeonhole us, and that's really not the point. The point is to see the whole picture and then try and get to the underlying influences that are causing the inflammation or driving the symptoms or whatever the case might be. So that is a very important piece to this puzzle, that this is not meant for diagnosis. If in fact I feel that there needs to be some sort of further intervention, let's say, I would then refer them to their physician in order to do that, because that is out of my scope of practice. And then also coming to me with a diagnosis, while it's important for me to understand, that's not going to be something that we're necessarily targeting. We're really more concerned about what is happening under the surface. The diagnosis obviously is an important part of someone's medical history, because then that might explain why they're being treated with certain medications or why they're having certain symptoms. So the more that we know about someone, the more effective we can be in supporting them. However, it is just one piece to the entire puzzle. So very important, very important. So to reiterate that, conventional lab testing is typically used to diagnose and or monitor disease. It is used to detect existing medical conditions. And so that is really where our healthcare system is going to shine, is in that arena. Whereas functional is going to look underneath the surface and try and understand the root causes of disease, the root causes of health issues, by identifying how the body is functioning on a deeper level, which when you think about it in that regard, what we have to consider is diseases are not just happening to us. There is some sort of malfunctioning taking place underneath the surface. And that can look like a number of different things, but there's some sort of malfunctioning, dysfunction that is taking place that is driving this diagnosable disease. And sometimes it's not diagnosable. Sometimes it's just dysfunction or, a syndrome, which is just a collection of symptoms. But we have to consider how disease doesn't just happen. It's not that we just wake up one day and we have a disease. Oftentimes that the diagnosis for a disease or the symptoms that are taking place happen way beyond the time that the onset of the disease actually took place, right? Dysfunction has to happen in order for that to take place, and that's not an overnight process. Our bodies are so resilient and our bodies are so intuitive and intelligent. And so it takes a lot for our bodies to get to a point of disease. It takes a lot for our bodies to get to a point of that diagnosis. And I think a lot of people think, oh, I've gotten this diagnosis, so now this is when it starts. It's actually something that's likely been happening under the radar for many years, or maybe those subclinical symptoms were kind of the quiet whispers, we'll call it, that our body was signaling to us like, hey, listen, tune in. Let's look underneath. Let's figure this out, right? And then eventually when they became more prominent, or we finally got that diagnosis, or it reflected on our traditional blood work, that's when we finally got an understanding of, okay, this is what's going on. But this is important. And I think that this is something that is really misunderstood in our healthcare, is it's not just an overnight or a couple days or a couple weeks and suddenly this is happening, like with chronic disease or anything of that capacity. This is over the course of time. This is a development over the course of time that led to this issue. And all those symptoms along the way, whether they were infrequent or maybe they were a little bit more persistent, but we kind of just dismissed them, or we medicated with an over-the-counter medication or whatever the case may be, all of that was contributing to that eventual diagnosis. It just wasn't something that we paid attention to because, as I said, they were subclinical symptoms. And unfortunately, I think we normalize a lot of these symptoms and we accept that we should be living at a 5 when we could be living at a 10, or we don't know that it's possible to feel better because we've just been living in this existence for however long. And I think that's the problem, is living at a 5 is the dysfunction. Living at a 5 is the dysfunction and the imbalances and malfunctioning of the body. And some of us, and I would argue a lot of us, don't realize that that is in fact dysfunction. Because either we've lived our whole lives and we've always felt this way, or we don't think that there can be any better, or we've just accepted, or this is just a part of getting older. And then it's not until later on that we get the diagnosis, and then we are approached by our healthcare system with medication and lifelong dependency on such medications. And so I challenge you to tune in to this concept in your own life as best as you can. This idea that symptoms are often the tail end of the dysfunction, and dysfunction can be happening underneath the surface, underlying, and we have to be proactive in understanding our bodies more, taking care of ourselves. I always say that proper nutrition, moving our bodies, sleep, living as non-toxic, low-tox as we can, and all of these concepts is the insurance that's going to help us ward off or eliminate some of these subclinical symptoms and then prevent, hopefully, progression or development of disease, diagnosable disease. But you have to be willing to tune into your body and notice when things are not right. And then even further, be willing to invest in your health. So with functional testing, this is a great place to start. I think people fall into a couple different categories when it comes to investing in functional testing. The one category is they're symptomatic and they haven't gotten any answers from their doctors, so they want to dive deeper and seek out additional support. And then there's other individuals in another category where they're saying, yeah, like I kind of feel fine, and there's nothing overtly uncomfortable that I'm experiencing, and I'm just living day to day. I take pretty good care of myself and so forth, which is wonderful. But I still think that you can take these tests and learn so much about your health and even optimize your health, especially because they're giving you a point of view that you probably have never had before. You've probably never understood your detox, your level of inflammation, your digestive health, hormones on this level. There's so many things that you can learn from it and just further improve and better understand your body and utilize this as an opportunity to invest in, like I said before, optimizing your health as opposed to just kind of getting by. So those are just two different categories of people who might feel compelled to invest in something like functional lab testing. And there are a number of other categories of people who would benefit absolutely hands down. I know for me personally, I didn't necessarily have anything terribly pressing as far as symptoms go to seek out testing Last year, I did do functional testing for the first time. I was having more pain around my cycle, and I noticed that kind of progressed, I don't want to say quickly, but definitely within the year prior. I noticed changes in my cramps, which was something that I always kind of navigated since high school, even honestly since, I don't know, I was 13, 14. And even during my luteal phase, I was having disruptions with sleep. And I'm trying to think of what else. I did have an ovarian cyst rupture in March of 2022, and that was something that came out of left field. And so that already as it is, I wanted to take a closer look at like my reproductive health and understand what could have influenced that, because that just felt so random. And then I was also having some abdominal pain last summer. Was it last summer or the summer before? I don't remember. No, I think it was the summer before. So maybe this is all within the last 2 years. We'll just call it that. I'm not going to try to give you the specific timeline because I don't. What month is it? We're in April 2025. Okay. So 3 years ago, holy cow, 2022 is 3 years ago. 3 years ago, I had an ovarian cyst rupture around this time. It was the 31st of March. I remember that. And then fast forward, through that experience, actually, I found I had gallstones, which it's fascinating because I know now what was going on with my liver. My gut health in my early 20s definitely played a role in this. And that was something I didn't know was there, and I had no issues. And then it wasn't until 2023 that I started to notice there was discomfort around my gallbladder region, and I was going through all sorts of testing and so forth. And then finally decided to seek out functional testing because I was not getting any answers from our healthcare system, and it was exhausting. And I am so embedded in this space, this holistic health space, this functional health space, that it was kind of a no-brainer and a organic next step for me to seek out this type of support. Now, obviously, it comes with its cost. It comes with a little bit of research because you have to find someone who orients in this way. But I also was super, super interested in getting a GI map. And for those of you who don't know, a GI map is something that I think every single person should have access to. Our primary care physicians should just be offering this with annual lab work. I think it is one of the most valuable. And because Hippocrates says all disease begins in the gut. And if you have listened to the podcast at all, you know how passionate I am about gut health and how much I talk about gut health, how gut health is connected to our mental health, our hormone health, our liver health. Every single function within the body is impacted by gut health. And I don't understand why more of us and more of our practitioners and healthcare professionals are not employing this test. But anyways, this GI map helps to uncover and look closer at our microbiome. It can look at pathogens. It can look at inflammation. It can essentially give you a bird's eye view of what's going on in your gut. And my journey started because I was having a lot of symptoms that were rooted in poor gut health and poor liver health and poor detox. And I didn't know this until later on. But what's fascinating is I was using antibiotics pretty regularly, and that is going to completely wreck your microbiome. Because what happens with antibiotics is you're wiping out whatever it is that you're attempting to wipe out, but you're also wiping out the good bacteria as well. We can't necessarily tell the antibiotics or program the antibiotics to just take out the bad guys. It's going to take out everything. So I'm taking these antibiotics without knowing that there should be some aftercare involved. So side note, if you're someone who has a history of antibiotic use, or you are currently taking antibiotics, longer term or whatever the case might be, a GI map would be something that I would suggest to you. But anyways, I spent so many years in this space and continued to struggle with symptoms, chronic sinus infections. And so I think one of the best things I could have done at that moment in time, but also as soon as possible, was complete a GI map to look at my microbiome. Surprisingly, I got this done, was it last spring? I don't remember if it was last spring or the spring before. Whenever it was, I completed the test and I was really expecting to see some interesting results. And I was pleasantly surprised. There really wasn't a whole lot of concern. There was some imbalance going on, and so I worked on that. And otherwise, it was a pretty, mild result, which I was shocked by. But I think in reconstruction over the course of the past probably 5 years, I've put in a lot of work there. And so that's probably why it reflected as so. But looking at your gut health, whether you have digestive issues or not, let me say that again. Whether or not you have GI issues, you can benefit from a GI map. And this is because there are a lot of symptoms that can be GI related that are not digestive in nature. So brain fog, anxiety, joint pain, things of that capacity have been connected to dysfunction within the gut. So you might say, oh, my digestion's fine, which I would argue that's probably one of the most common issues I see is indigestion, constipation, diarrhea, acid reflux, you name it. These are some of those subclinical symptoms that we have so normalized that we're not paying attention to. And a GI map can be one of the best things for us to better understand, is there a leaky gut? Do I have dysbiosis, which is an overgrowth or an imbalance of bacteria? Are there any kind of overgrowths? And more. And this is just a good general health practice to get into. To regularly check in. How is my gut doing? How's my microbiome doing? Can I benefit from a probiotic? Can I benefit from including more fiber? Can I benefit from reinforcing my gut lining? There is so much benefit to just doing it as kind of a regular check-in, not just when symptoms appear. That is something I would highly suggest anyone to do if you are willing and open and capable, simply for the sake of just better understanding your GI, especially if you're going through a period of stress or you have to be on antibiotics for some reason, or you're having any type of sensitivities to foods or reactions or symptoms that are kind of just appearing and you haven't had this issue before. I mean, there's so many reasons and it's only going to benefit you. I also really believe that we all need to be testing our cortisol. And if you don't know, cortisol is our stress hormone. And in today's day and age, a lot of us have issues in this department because of the nature of the modern world. And by better understanding your cortisol pattern, you can understand so much more about your health, so much more about your sleep, how you're feeling throughout the day, your energy levels. So that is something that I feel everyone could benefit for if I'm going to lump these tests together, your GI, and then understanding this specific hormone. Now, it's not to say that all of our other hormones are not equally as important, and that's something we can absolutely test, especially because I feel as though you go to our healthcare system, you go to our primary care doctors and whatnot, and there's a few things that can happen here. Either you ask to get your hormones tested and they say, why? I have to chuckle a little bit at that because I think this happens a lot, where you go to your doctor and you say, can I please test this? Can I please learn more about this part of my health? And they say, why? Or they say, no, you don't need that. And I get it. They're up against insurance and there's complications to it that I probably don't even understand. So I don't want to discredit or disrespect doctors in any way. However, I think we should all be allowed to request testing to understand these areas of our health a little bit more. But it's just simply not as comprehensive. And a lot of times normal ranges are different than functional ranges. And that's a huge piece to this puzzle too. When we look at a normal range on blood work from our healthcare providers in Western healthcare, we are typically seeing a range that is much greater than what is considered optimal. And this was something that I came across when I was looking back at my blood work probably for the past 5 or 6 years looking at my vitamin D. And my vitamin D was chronically low for many years. And unfortunately, there is a difference between what is conventionally normal and what is optimal. And for my sake, I fell on the lower end of what's considered the conventional normal range, which through an optimal range perspective, this is pretty low. This is very low. To give you a little bit of an understanding here, you're deficient according to Western healthcare if you're below 20. It is insufficient 20 to 29. It's sufficient/normal 30 to 100, and toxicity is above 100. Now, a level of 30 is considered the threshold for sufficient vitamin D. But if we're looking at it through an optimal range, 50 to 80 is the optimal range. So I was in the 20s. And while this was insufficient, nobody was making that known to me. And unfortunately, people sit in that 30 window and the doctors say, okay, this is normal, but I don't want to be normal. I want to be optimal. And this is the case for so many different types of tests. And that's really unfortunate. So similarly to this vitamin D conversation, that falls into a lot of other tests as well when it comes to the difference between functional optimal ranges and then what's considered more conventionally normal. And it's up to us as individuals to look at our own blood work and understand, okay, well, all of this is coming back as normal. And even further, right? Even if you fall on the lower end of the range or at the higher end of the range, that's something else to consider too. Just because you're 89 and you're not 90 doesn't mean that's not still significant if the abnormal range starts at 90, right? If you're at 89, yeah, you would still be considered to fall into that normal range. But if you were at a 90, and this is just a random example, but if you fall into that 90, that's when it becomes an issue. That's when the conversation would be had. That's where, you might want to consider looking a little bit further or considering your options and so forth. So just something to keep in mind that you're not going to necessarily see those optimal ranges as you would in a more functional space at your primary care if they are not operating from a more holistic functional perspective. So another big difference between functional testing and conventional testing is looking at the relationship between test results as opposed to looking at them in a more isolated way. So I feel like this is something that's not considered enough in our healthcare. And when it comes to functional testing, we'll be able to look at each of these markers because immediately right off the bat, we start with 5 tests that will show us the picture as opposed to, let's just do one or let's just do the other. Let's look at all of them because inevitably the body is interconnected and inevitably there's a relationship amidst all the results, amidst all the dysfunction. And this will help us get a better understanding of where it all began and what is driving all of these issues. Now, it's obviously to no surprise that addressing the dysfunction and getting to the root of the problem and feeling better is going to be then approached by dietary changes, stress management, modifying one's lifestyle, supplements, rest, and all of that comes along with a more holistic perspective. And so it's not about addressing things with medication because that's certainly not something that I can do as a practitioner, but instead addressing the dysfunction, restoring balance within the body, addressing one's detoxification system, supporting the gut, removing the stressors. I mean, that's first and foremost in this whole process is removing whatever it is that's contributing to the dysfunction. And oftentimes that's the processed foods, that's maybe food sensitivities, that's toxins, that's maybe a pathogen, some sort of infection or toxicity within the body that needs to be addressed. I mean, there's so much information that's gleaned from these tests, and they really allow you to see things from an entirely different perspective that you wouldn't otherwise know. And for anyone who is just getting into the functional health space, a lot of this is going to be completely new to you. Things like mold toxicity, that I feel like is not something that we talk about enough within our healthcare. Hormonal imbalances that we're not just throwing birth control at, looking at the gut through a more productive lens as opposed to here's an antacid, which can oftentimes be really counterproductive. And speaking of, looking at low stomach acid, infections, things like H. pylori. I mean, there's just so much to be uncovered from this. And the beautiful part about it is we get to see the entire picture and understand it from that whole body perspective, which is not something you're going to get from your primary care doctor. Your primary care doctor is going to say, go see a gastro, go see a gynecologist. And that suggestion or that recommendation is just based on the fact that we do have specialties within our healthcare. And while there's one individual who's going to be proficient in one area of the body, and that's because we need those individuals to be especially proficient in their area of the body, it is keeping us from putting the picture together. And so that's the problem, is we're not seeing the whole picture. And luckily through functional testing, we can get a very, very clear understanding of this is where the dysfunction is, and these are the steps that we need to take in order to address it. Another way that it differs from conventional healthcare testing is we want to know all the things about your history. Because guess what? Every single thing that you have done up until this point is going to influence the experience you're having today. All the way back to, were you born vaginally or by C-section? I mean, give me all the details, because that is going to help me better understand who you are and why things look the way that they look. That is so valuable. And this is not something that your primary care doctor is going to be concerned with, unfortunately. Now you have records, you have medical history, there's always that information available to them, but I want to know more about the environment in which you were raised and the foods that you ate and so many other factors that determine your development and who you are today. So that is a very, very big difference as well. And similar to what I was just saying about how fragmented our healthcare system is, doing something like functional lab testing allows you to touch on several different areas of the body without having to go to multiple different specialists. And I think that is where healthcare should be. We should be looking at the whole picture, as I mentioned before. But when it comes to functional testing, we can look at intestinal permeability, gut microbiome issues, gut inflammation, gut dysfunction of any kind. And alongside that, we can also take a look at our stress hormones, our reproductive hormones, our thyroid hormones. And then alongside that, we can also look at energy production, how our mitochondria is functioning, oxidative stress, how our body is able to utilize the nutrition that we're consuming. Are we absorbing the foods that we're eating and the nutrition that's coming from that? We can look at detox, which you know how I feel about detox. Super, super important. And it's about looking at all of these areas on a much deeper, more cellular level, as opposed to, all right, I have to go see a liver specialist for detox, or I have to go see the GI doctor, or I have to go see an endocrinologist. I can instead look at how all of these pieces to the puzzle interconnect in order to support my body more effectively so that it functions better. That is the ultimate goal. Really, that is the ultimate goal. That is what I want you to take away from this episode. Functional lab testing, the point of it is to identify hidden stressors, is to identify the dysfunction that's underneath the surface, any kind of imbalance, and remove or address those issues so that our body can function better. Why would we not want our bodies to function the best that they can? If they function well, if they're doing what they need to do, then we'll feel better. Then we won't have issues. But unfortunately, this is not how our healthcare system works. Our healthcare system looks at it as a very treatment-focused approach. So it's about once you get sick, then we address it, as opposed to preventative care. And the only reason why our bodies are dysfunctioning is because of the modern world. Because every single thing that exists within our modern world is misaligned with health. It is not aligned with health. So it's about understanding your health, understanding your individual needs. I mean, I don't think I need to say this, but obviously when it comes to this type of testing, we're looking on a very individual level. There's no one size fits all. So we're considering, here are the test results. This is what the client's experiencing. How does it all play into each other? Because what you could be experiencing could be completely different than what someone else is experiencing. And you could have similar test results and vice versa. You could both be experiencing the same symptoms or similar symptoms, we'll say, and have completely different test results. So you think about it, if you go to the doctor and you have certain symptoms and another person goes to the doctor with certain symptoms, you're likely going to get the same form of treatment. And it could be originating in two completely different areas of the body. And it's just putting a Band-Aid on the symptom. It's not really doing everything that it can in order to prevent that dysfunction from persisting. That, I think, is my biggest issue, is we are allowing this underlying dysfunction to continue to persist, even if we're alleviated of the discomfort, right? Even if we're not feeling the symptoms anymore, the dysfunction's still there because we haven't gotten to the root. Now, that's not to say in functional testing there aren't strategies for us to approach discomfort in the immediate term in order to make the client more comfortable. There's a lot of remedies and solutions to mitigating the discomfort of symptoms in the interim while we work on addressing the underlying problem. And so I'm a big supporter of that, because obviously if I say to you, okay, listen, your protocol is 90 days, which on average that is the length of time that we have clients commit to the process. And then obviously you can evaluate at the end of those 90 days. But for someone coming to me who's in discomfort, they want relief now. They don't want to wait 90 days. So there are ways for us to address that so that there's a little bit of relief that can come along. But it's not just about here's the medication, here's the treatment, and you're on your way. It's about let's look at underneath the surface, underneath the hood, and really identify what is going on here, and then we can actually restore the body. Because most cases, you it's kind of like whack-a-mole, right? I've heard this example used a number of times where you're given a medication for one symptom, the dysfunction persists, and then other symptoms show up or other issues take place. And so we have to get to the root. We have to get to what's causing this dysfunction in order for you to not play this game of whack-a-mole where you feel like you're constantly in this cycle. It's the trial and error cycle. It's a vicious cycle. It's a unsuccessful cycle. It's a cycle. A cycle never ends. So you have to consider, where are you in that cycle? Have you been in a cycle before? What have you tried? I mean, that's really important to me too as a practitioner, to hear what you've tried before. And then that can better equip me to supporting you as we move forward together. So it's a completely different approach to health. I obviously am a little biased in saying this, but I feel it is the most effective approach to health. That's not to say that we can't still benefit from understanding your health from the support that you've gotten from your primary care doctor or blood work you've gotten done. That's going to be valuable in the process, but taking a deeper dive is what's really going to allow you to feel better and to address issues once and for all. The few tests that I mentioned are the ones that are typically right off the bat ones that are included in the process. And we also look at something called your metabolic type, and this is going to help us better understand what type of diet is best for you. I just did it on myself a couple weeks ago and just got to learn a little bit more about the test, but this will help better equip us to support you nutritionally based on how your body utilizes and produces energy. So that's something else that's included. But as an FDN, outside of the few tests that I mentioned, the metabolic wellness profile, the stress and hormone panel, the mucosal barrier assessment, the GI map, there are hundreds and thousands of other tests available as well. So getting these initial test results can help a ton and can be really, really valuable. And so much progress can be made from just that alone, but there's also a ton of other options for us to explore if in fact there is a need for us to look a bit deeper and take a look at other additional testing that's out there for your specific needs. So that really is the overview, I guess you could say, of what functional testing is. I want to just rapid fire a few of the answers to some of the questions that were sent to me via Instagram, and hopefully this helps to give you a better view of testing. Someone asked, how is testing done? So testing is done through saliva, urine, stool, and or blood. So depending on the test, that is how you will essentially complete the tests. Some can be done at home. Some are done at a testing center. So it all depends on what test it is that you are completing. And they're very user-friendly. They come packaged very straightforward with a return envelope included, instructions. I mean, it's very, very user-friendly. So there's really no confusion. Obviously, I will always be available for questions about the testing and if you need support in any way. But it's a very straightforward process. I think to me, the most challenging part of it is for a lot of the tests, it does require women to complete it on days 19, 20, or 21 of their cycle. So just being sure you're doing it in that window. And if there requires multiple samples taken over the course of the day for whatever it is that it's testing, that to me is the hardest part. And of course, taking a stool sample isn't the most pleasant of all experiences, but I think it's one of the most valuable things that we can do. And it's also going to give you the most accurate picture. The route that each of these tests take, whether it's blood, saliva, urine, stool, the intention there is because these are going to be the most reliable avenues by which we can get the information that we're looking for. And I think that that's so important. If you're going to the doctor, 99% of the testing that's done is through blood, and that's not always the most reliable route when it comes to a certain type of marker that you're looking for. So this, I think, is really important to consider too, that the saliva tests are saliva tests for a reason, the blood tests are blood tests for a reason, stool tests are stool tests for a reason, and so forth, because it gives you the best picture based on what you're testing for. So another question I got was, how much are the tests? Understandably so. I expected to get that question. So essentially what it will look like is how I will be charging for working together for 90 days. So that is to be determined. But if you sign up for the informational email, you will get details about that in the next few weeks. And then also paying for the tests as like an a la carte option. So that will all be determined, like I said, in the coming weeks. You'll get a clear picture and understanding of how it works. And then any additional test, I will be very transparent with you about the costs involved and my rates and so forth. So there will be both the cost of the test plus working together and my rates, and that will be made very clear upon our first call. I will have all of that detailed out on my website. You'll always have access to that if you do have interest in testing. I got this question 2 different times. Someone asked, or 2 different people asked, how long does testing take? How long does the process take, essentially? So the process will be 90 days. That is the kind of baseline time that we'll spend together in terms of implementing the protocol and monitoring progress and so forth. Testing takes some time because obviously we can't expedite the results necessarily, but that is where your role comes in, and just being sure that you are getting the test done and submitting them. It can be a little challenging when working in this regard because you obviously want to be sure you're getting the test results out, that they're not sitting around for days and weeks at a time, because that will eventually invalidate them and they won't be able to be used because they won't be able to test the sample anymore. So it's super, super important that you are completing the tests and sending them out ASAP. And then obviously there's a window of time before the results come in. But as soon as the results come in, we meet, and that's when we implement the protocol. And then obviously there will be options for you to check in with me. I haven't yet decided on how I'll structure them because obviously I want to be able to give you support as the protocol unfolds. It's going to be different than what I do now with coaching, which is a week-to-week process. But when it comes to working with clients through functional testing, it's going to be less frequent, but there'll still be options to add on calls or to check in via chat, just because I do believe that having that support and accountability can be really, really important for success. I felt like in my experience with functional testing with the program that I completed it through, that wasn't there. That check-in, that accountability, that kind of progress report, I guess. And I probably could have utilized it a little bit more actively, but I just didn't feel like I was really supported through the process. And that, I think, is something that I want to do differently. I want to be able to offer that so that I am supporting someone in a way that is most helpful to them, while also giving them the autonomy to implement the protocols on their own. Someone else asked, do I need to retest after I've completed the protocol, or after I've completed the program, was the word that this person used. And the option is in your hands. I mean, some people like to retest. Some people just like to go based off on how they're feeling. If their symptoms have subsided, or they're noticing an improvement in how they feel, then it's not necessary, because obviously there's a cost associated with it. But that's always an option. If you wanted to retest, you're more than welcome. I would happily support you with that. And it also just depends on the situation. It depends on what test it is. It depends on what you're feeling, what the protocol looks like. I mean, I think it's a pretty individual type of consideration, because it all just depends on your circumstances, what the situation looks like, and what kind of progress you have in fact made. Some of the most common questions I was getting had to do with certain symptoms and if testing would be right for those specific symptoms. So I just want to run through some of the more commonly seen symptoms, or the symptoms that I think would benefit most from functional testing. Now, I think any symptom at all can be looked at under a microscope, and we can look a little bit deeper, but these are some of the more common. So anything with fatigue, low energy, anything having to do with your energy, and then subsequently your sleep quality. So whether you have insomnia, whether or not you have trouble getting to bed, waking up in the morning, your energy levels are imbalanced throughout the day, you have an afternoon crash, anything having to do with energy or sleep. Yes. I cannot say more about this. Absolutely 110%. Tiredness, persistent low energy, feeling tired even after sleeping all night, being up at night, having trouble getting up, crashing mid-morning, crashing mid-afternoon, wired at night. I mean, the list of symptoms having to do with energy go on, but anything having to do with that, hands down, absolutely. Now, alongside that, just as important, any kind of symptoms having to do with digestion, bloating, gas, diarrhea, constipation, abdominal pain, heartburn, discomfort after eating, or feeling like you have some sort of sensitivity or intolerance to certain foods. The list goes on there. There's so many digestive related symptoms that I think we've just normalized, and we have to be more aware of it. And this can be one of the most powerful ways to do that. Hormonal imbalances, I think, are so incredibly common, and they are under-recognized. What we don't realize is our hormones are a symphony. And so one off instrument in one area is going to affect the rest of the symphony. So irregular periods, hot flashes, night sweats, that's, very common with perimenopause, menopause, mood swings, extreme cramps. That was something that I navigated, heavy flow, missing periods, low libido. there's so much that can be uncovered and restored no matter where you are. Ladies, I'm talking to you. This is not exclusive to ladies. This can be for men as well. But especially, I think the greatest interest that I'm seeing for something like this is in perimenopausal and menopausal women, postmenopausal women too, because they're not getting the support that they need from their doctors. Plain and simple. They're just simply not getting the support. So functional testing can be a great way to help support the body as they move through those hormonal changes, because what's not talked about enough is how you're supporting your body in your 20s and your 30s is going to determine your experience as you move through perimenopause, menopause, and then afterwards. So this is huge. If you can address this now, that experience will be so much more, maybe not so much more, but so much less difficult or uncomfortable. Because unfortunately, that's the nature of so many women's experience now, is that time of life is just miserable for them. Another thing I could add to this is also pregnancy and preparing the body for pregnancy, and even post-pregnancy, supporting the body afterwards. I mean, the better shape you're in, not from like a physical perspective, but more just from a health perspective around what your gut looks like, your detoxification systems, addressing any kind of inflammation, the healthier the baby will be. So I find that to be really, really valuable. Another question that I got was around unexplained weight gain or difficulty losing weight. I mean, this is a question I actually got directly on Instagram, but then also this is something that I get asked by clients all the time, and I talk about this all the time. Symptoms are messages, and gaining weight unexpectedly or having trouble losing weight, even if you are exercising and eating well, can be indicative or manifestation of something underneath the surface. And so testing can help to uncover that. I already mentioned sleep issues, any kind of joint or muscular pain, that can also be relevant. I mentioned before, this can be super relevant to our digestion and our GI, but also just inflammation across the board. That's, that can help to uncover where is this inflammation coming from and how can I address it. Even anxiety or depression, looking at that through a more functional lens. I'm not working as a therapist. I'm not working as someone who's going to provide mental health services, but if you're having symptoms like that, that can definitely be a result of hormonal imbalances, issues with neurotransmitter production. That can be a blood sugar issue. That can be a gut issue. There's so many different possible causes that don't include what our healthcare system acknowledges as being the cause. Low immunity. I think this is another one that I don't think we talk about enough, and that can be uncovered. Any kind of skin issues. I know there's certain people who work with functional practitioners who are just specific to skin concerns. So acne, I could have used a functional practitioner when I was 20, 21 because I was dealing with such painful acne. Or eczema, psoriasis, rashes, whatever the case is. All of that can be related to our gut, to inflammation, to sensitivities, and so forth. Food sensitivities and intolerances and things of that capacity can oftentimes be uncovered by functional testing, and I think that's huge, especially because there are also different sensitivities, intolerances, and allergies. And when it comes to sensitivities, especially, sometimes we don't notice the symptoms associated with that specific food until days after the fact. And so we're not quick to say, oh, this must be the reason why. And I think that is really hard for someone to piece together, as opposed to I had dairy and now I am having X, Y, and Z symptoms. Sometimes this isn't something that's happening until later on. So better understanding that, that's an immediate way to eradicate inflammatory foods for you specifically by understanding, okay, my body doesn't agree with this, or I need to cut back or eliminate these foods for this amount of time, and let me see how I feel. And of course, those are just symptoms, but any type of chronic issue you're navigating, whether it's high cholesterol, high blood sugar, insulin resistance, high blood pressure, there's so many different ways that these tests can be utilized, and I just cannot wait. I cannot wait to help people feel better and get to the root of their issues in a much more in-depth way than, just working with them on their lifestyle and so forth, which, don't get me wrong, that has been tremendous and I've loved that, and that's obviously going to continue to be what I do, but this specifically just brings it to a whole other level. So I'm very much looking forward to it. So I hope that this episode was helpful for you. I know I kind of went all over the place, story of my life, around the meaning of functional testing and how it differs, but really what it's showing you is so much of underneath the surface, so much of how your body's functioning through different markers. So the different markers signify how you're digesting certain things or how you're detoxing, or, all of that is uncovered through these tests. And I think it's such a powerful way to see your health, because it's unlike anything other. It's unlike anything other that you will have access to within our healthcare system. And I think that it's one of the most valuable things that we can do. So as I mentioned at the beginning of the episode, you can go ahead and take a look at the show notes. I've put a link there for you to complete the inquiry form if you're interested in getting on the list to learn more. The list is going to receive emails in the coming weeks about how to sign up, pricing. I will give a detailed overview of what each test does and why it's important, how the process will work, any kind of onboarding information. I mean, it's going to be every single thing that you could possibly need. So go ahead and fill out that form, and you will hear from me in the coming weeks. And if this is an episode that you're listening to later on and it is no longer April of 2025, then I am well underway with testing. So please feel free to visit my website. It is linked in the show notes, and you can learn more about testing. You can also schedule a consult if you're interested, and we can talk there, and I can learn a little bit more about you and your needs and to see if functional testing is right for you and your situation. But either way, I appreciate you for tuning in. I appreciate you for being here and listening in and learning a little bit more. And I look forward to supporting you. I really cannot wait. I love talking about wellness. I love supporting people in their wellness. And I know that this is one of the very best ways that I can do that. So I'm grateful for this opportunity, and I look forward to supporting you. So once again, thank you for tuning in. Thank you for being here. I hope you enjoyed today's episode. And until next time, be well.